Hello and welcome. First of all, housekeeping. This is still not a medical advice and all rights are reserved. This video is still for entertainment purposes only and does not constitute any form of medical advice. If you have any question, please ask your doctor or healthcare professional. Thank you. Migraine is more than a neurological or vascular disorder. It is a complex field phenomenon that arises from the collapse of the Shaoyang Gate. The Shaoyang Gate is a sandwich formed by the soul, best described as a floating magnetic field, a structured water grid, the lipid membrane, structured water grid again, and finally a fine mesh of microtubules inside the cell. When this sandwich gets blocked and disintegrates under excessive charge or a fragmented water grid, we see pain and migraine. In this presentation, we will explore how Western and integrative medicine can merge together to better explain clinical findings. This slide introduces a biophysical interpretation of the living cell. Mitochondria act as a power source plugged into the fascia water grid. The endoplasmic reticulum serves as a capacitor to absorb excess charge and keep charge constant for the functional consumer, which is the membrane-associated structured water grid, which is to scan and translate subtle magnetic changes in the soul, described as free will. This perspective shifts our emphasis from mitochondria towards the cell membrane and water grid, highlighting how resonance and energy flow truly occur in biological systems. Pain is not just an overfiring nerve. It is the collapse of the resonance sandwich, what we call the pain-filled coil. The soul field tries to connect to the body from above. The structured water layers on either side of the membrane translate it into coherence and resonance. Microtubules and fascia conduct this into biological function. This translational system is what the Shaoyang represents. When destabilized by interference patterns, it collapses, resulting in migraine and swelling. The EZ water grid is particularly sensitive in the head and the eyes, where the fascia is delicate and spatial limits are tight. Overpressure causes collapse and swelling, registered by nerves as pain. Western medicine treats this by blocking the nerve so pain cannot be felt. Integrative medicine uses herbs to reorganize the field and soothe the nerves. Additionally, the eyes requires extremely high coherence in a very small volume to conduct and operate vision. Mitochondrial weakness in this area causes this grid, the water grid, to drop suddenly, so it disintegrates into bulk water and causes swelling. This may obviously block and obstruct capillaries. If inactive metabolites and sterile inflammation enter as a result of a low coherence, low energy field, the EZ grid freezes and collapses and stops functioning. Other signs of this fragmented, rather dry EZ water grid field include dryness everywhere, as dry mouth and stool, dark urine. If the patient goes into pregnancy, poor weight gain in pregnancy, oligohydramnias, difficulty calming down at night before going to sleep because the fascia grid is excessively noisy. And finally, the strong man or strong woman syndrome. In contrast, when the EZ grid becomes overcharged and polluted from waste or biofilm, we call it, inactive metabolites, other symptoms appear. Sinusitis, productive cough, nausea as a form of or sign of biofilm formation in the stomach, diarrhea coming from a biofilm covering the epithelial lining of the gut, and poor digestive function, and finally weight gain as a form of edema or bulk water buildup when structured water disintegrates and becomes bulk water. We will explore this mechanism next. So when the field becomes overcharged, the EZ water grid cannot contain it and starts to break down. Water is drawn into the extracellular matrix, binding to the local macromolecules such as glucosaminoglycans to localize this overload. But if this local buffer fails to contain and keep the charge, the excessive chaotic charge in place, this charge penetrates along the membranes and goes into the cell, reaching the endoplasmic reticulum, which is continuous with the cell membrane, and starts interfering with protein synthesis in the endoplasmic reticulum. Waste accumulates as a form of inactive metabolites or proteins, inappropriately folded proteins. We call it misfolded protein syndrome, or the Chinese call it dampness formation. This triggers autophagy, and which is a form of sterile or autodigestion, and we go into sterile inflammation, leading to swelling and increased capillary permeability and vasodilation. This is what we can see in migraine locally. Mitochondria try to respond to the high energy demand locally by increasing their metabolic rate up to a certain degree. Therefore, they demand more nutrients, and adding to vascular dysregulation and vasodilation. Neurovascular coupling results, one of the core issues in migraine when there is excessive vasodilation. Western medicine uses serotonin agonists to reverse this vasodilation. While effective in the short term to stabilize the situation, first of all, not everybody can take it or tolerate it. Even more, the long-term picture may become more complex. We will return to this topic later. Migraine pain usually starts over the temporal area, which is covered by gallbladder meridian, and it is drained by the gallbladder meridian. When this meridian is overloaded by an interference pattern in the gallbladder, it fails to drain this area properly. Charge builds up locally, trying to find the way of least resistance in the facial plane. This is often the face, which is the area of the stomach meridian. see it as cluster headache. Other times it spreads backward along the facial field towards the occiput, which is drained by the bladder meridian, causing tension type headaches. In integrative medicine, the stomach meridian drains the trigeminal area. So emotional workload blocks digestion. So the body fails to digest this burden, blocking the stomach channel, which blocks the face. Pressure and charge builds up, so cluster headaches and sometimes auras appear when this charge, excessive charge, reaches the eye and the optic system. Auras, whether from migraine or epilepsy, are understood as chaotic field discharges running on a disintegrating water grid, especially in the visual cortex, when this disintegrating fragmented water grid starts to spark on the edges. So the edges of this grid and these grid islands may produce sparks seen as visual disturbances. This is why integrative medicine uses cool and pungent relaxing herbs which are designed to rebuild this fragmented water grid, so chaotic field charges disappear and they get absorbed by the continuous water grid. Additionally, vitamin B12 is, for example, acting on this field as a resonant or redox switch, which means that it can also absorb excessive charge and harmonize chaotic field waves in the system. So the eye is essentially a structured water sphere. Its EZ water grid has extraordinary coherence, packed in a very small space, achieved with high energy in a tiny space to provide accurate vision for us. When the system is overwhelmed, and we can imagine that it becomes overwhelmed very easily, it breaks down first. So under stress, the liver secretes acute phase proteins, so the blood thickens and it will be more difficult to circulate. And mitochondrial exhaustion causes the liver back up to the eye, which means that the local magnetic field becomes exhausted and the liver backs it up as a generator along the facial planes. This is called liver young rising in traditional medical systems. The eye reflects the tension of the fascia matrix throughout the body, just like other signs of this tense and inflamed facial grid, or the trigger burner in traditional medical systems. So other signs of this dry and inflamed matrix and extracellular grid are carpal tunnel syndrome on the wrist, when the pericardium meridian or the heart or the lungs, usually pericardium meridian, becomes overloaded, or plantar fasciitis on the sole, which is where the kidney meridian gets blocked, often as a result as part of the adrenal fatigue and with low back pain. So we can see the subtle signs of systemic dryness, inflammation, and fascial connective tissue disintegration. This is our aim to solve this fine matrix and reintegrate, rebuild the structured water grid in this system. Classically, we can say that the liver opens into the eyes. Integratively, we can say that the Shaoyang gallbladder and membrane interferes with the liver-eye axis, causing blurred vision, photophobia, and orbital tension when the membrane system falls apart in this area. So this is not purely vascular, but more rather biophysical. It is a fascia-filled misalignment, a refusal to see the reality clearly. For example, in multiple sclerosis or myasthenia gravis, we can see that these conditions often begin with ocular symptoms or eye symptoms, despite being classified differently in Western medicine. In these conditions, let it be myasthenia or multiple sclerosis, migraine is interpreted as an excessive field charge coming from a repeated emotional trauma and an exhausted energy system, which causes the structured water grid to disintegrate and unable to handle this electrical charge efficiently. So another symptom or clinical picture is glaucoma, with raised intraocular pressure, often occurs with facial inflammation, connective tissue inflammation, for example carpal tunnel or plantar fasciitis. The point we are trying to make here is that these seemingly disconnected clinical conditions may become part of a complex and rather large picture, which is the triple burner dysfunction and inflammation from tip to toe. From a field perspective, Shaoyang disruption destabilizes the EZ water grid lattice. Coherence is lost. The soul is no longer translated into the body, and the field starts to flicker like a storm across the fascia connective tissue grid. Hence the fascia becomes tight, trigeminal pain comes over, or even distant symptoms like intercostal neuralgia along the Shaoyang gallbladder meridian system may appear as signs of this meridian instability. Migraine often carries a message from the soul. When an experience cannot be digested or embodied, it imprints into the Shaoyang. Result: recurrent pain, decision paralysis, and emotional resistance. Western medicine uses systemic vasoconstrictors to force local relief on the head, blocking neurotransmitters and attempting mechanical recoupling. The short-term results may be brilliant, but the long-term effects may become problematic. The reason is because this EZ water grid is usually fragmented or still remains fragmented, and the mitochondria are still exhausted. So serotonin agonists try to mildly stimulate the mitochondria, recharging the system and trying to force these fragmented water grid islands into a coherent and continuous system, forcing current into this broken circuit. The problem comes when this broken circuit cannot handle this charge anymore. and it mimics an ischemia reperfusion injury. Vasodilation and then vasoconstriction and oxidative burst, and the fascia cannot handle the mismatch, and the patient becomes worse than she or he had been before. The clinical consequences are increased pain from further EZ water grid breakdown caused by this excessive excessive charge flooding the fragmented weak water grid system, or intensification from sparks on the grid edges, dizziness from field instability, fatigue from mitochondrial exhaustion, and emotional detachment from failed soul grid connection. Nausea may also become worse from biofilm formation in the stomach. Biofilm and blood sludging are nature's trauma buffers, known in Chinese medicine as dampness and blood stasis, respectively. Nature delays field collapse through these buffer molecules and systems. The extracellular glucose-aminoglycan matrix formed by hyaluronic acid, chondroitin sulfate, and other sulfated macromolecules which can organize water into a hydrophilic surface, acting as strong cosmotropes. Fat droplets, photon buffers, energy storage. Melanin, which is a light and electron sponge. Ferritin and hemosiderin, which trap iron, which can also charge and dissipate excess charge, or amyloid formation and tau proteins coming from disintegrating and tired, overexhausted microtubules. These are emergency magnetic buffers, basically. All share a function: absorbing chaotic excess energy and preventing it from damaging the local microenvironment. But they come with a cost. Rigidity, they cause it much like rigid belief systems that resist change in life. To understand hematitum's role in integrative medicine, we must rethink iron. In hemoglobin, it is a phosphorescent redox switch, facilitating water phase transitions and gas exchange. In this context, it is a magnetic buffer, which can absorb excess energy from the system and clear it up, mop it up quickly and efficiently. As we know, free iron is toxic. It destabilizes the EZ water grid. But this is iron bound to large protein macromolecules. When mitochondria fail, iron is embedded in this denaturated protein complex and lipids to isolate it while preserving magnetism. So it can absorb excess energy while preventing local damage to the microenvironment. The only problem or downside of this solution is that it takes time and it rigidifies this membrane water system, which is difficult to remove after that. So in contrast, herbal iron coming in a formula is not bound in this way. It acts as a temporary buffer, catching energy leaks and then disappearing immediately without any long-term damage. or causing rigidity. This is the starting Shaoyang formula for migraine. The goals are to absorb excess field energy, restore membrane flexibility, provide a stable energetic pattern, and restore mitochondrial function. Finally, clear blood sludging and blood stasis in the microcirculation and remove metabolic waste via inducing autophagy or self-digestive mechanism. Serotonin agonists work acutely, but long-term they may be limited and poorly tolerated, especially in patients who cannot tolerate vasoconstriction elsewhere, for example in cardiac disease or Raynaud syndrome. Migraines may not be local to the head. Anxiety and palpitations and insomnia may represent this excess charge flooding from the head everywhere. It can go to the heart, causing insomnia and palpitations and anxiety. It can go elsewhere, causing, for example, asthma in the lungs or dry cough, for example. So systemic Shaoyang support may be needed to stabilize the system elsewhere as well. Serotonin agonists provide fast neural stability. This Shaoyang hematogen formula offers deep field restoration on the long term. Together, they should cause or result in fewer attacks, shorter duration, reduced light sensitivity, better tolerance and improved sleep, greater emotional balance and overall a better quality of life. We aim not just to remove pain on the short term, but to reconstruct the body as well. Psychological work is also essential to prevent re-triggering. We don't reject this Western migraine treatment. We aim to support and complement it, especially where patients suffer from side effects or have unmet needs. Healing migraine is not just about medication, but returning or retuning the membrane system and the body-soul connection. So the soul and the body can reunite again and into a coherent field. This is the true path to recovery. If you found this video interesting, thank you for watching and we will see you in our next presentations. Thank you.